Hi, this is Dr. Gary Sykes, and in this vlog I'd like to consider the topic of engagement of the baby's head. It's a very popular question I get asked in advanced pregnancy. Well, what does engagement of the baby's head actually mean? It means that the largest diameter of the baby's head, it's called the biparietal diameter just here, has passed through the brim of the pelvis. So once that's happened, the baby's head is engaged. Now, a woman will often know this because she has increasing heaviness in her pelvis, and also she feels there's a bit of a gap towards the top of the uterus, so it's more comfortable with eating, less indigestion, less heartburn. Now, I can detect this quite easily by examining a woman's abdomen. I can only feel the minority of the head on abdominal palpation, which means the majority of the head is below the pelvic brim. Also, I can feel that there's a gap at the top of the uterus, so this is called lightening here. So when this is apparent on abdominal examination, I'm able to tell the patient that your baby's head is engaged. On internal examination, we can tell it by checking where the top of the head is in relation to a bony landmark at the side of the pelvis called the ischial spine. So it's halfway down the pelvis. So if the tip of the baby's head is at the level of the ischial spines, it's considered to be engaged. If it's below the spines, it's engaged. If it's above the spines, it's not engaged. So that's what we do. I can do that here in the rooms, and certainly that's what we do in labour to assess progress in labour. Well, what does engagement mean for the patient? Well, it means that she's more likely to go into labour sooner rather than later, and more likely to have a good labour, a quick labour, an easier labour than otherwise would be the case. So it's very exciting. It also implies that the baby's head is in the occipito anterior position, in other words, is facing more towards her back than her front. Now, if the baby's head is not engaged and the baby is due and she's had a previous baby before, it really doesn't mean anything because the uterus doesn't grip the baby as tightly as it did in the first pregnancy, and there's no reason for the baby's head to engage. Indeed, the head will engage when she is in labour. If it's her first pregnancy and the baby's due and the baby's head is not engaged, it probably means not much. Probably means everything is okay, but it is more likely that the baby is in an occipito posterior position, in other words, to be facing more towards her front than her back, and the baby's head is what we call deflex. So the baby's looking up, which means there's a slightly larger diameter of the baby's head presenting. Now that can suggest that she's more likely to go overdue significantly and more likely to have a more difficult time when she is in labour. Sometimes, particularly if the head's really quite high, it suggests that the baby is a little bit too big for the birth canal. So it's going to be a difficult fit. You've got a bony head against a bony pelvis. So if the baby's head is too big, it's going to be a challenge. She may not even the head may not even engage when she is in labour, and certainly have challenges descending, and she may have difficulty in having a spontaneous vaginal delivery. So it increases the likelihood that she may need to have a caesarean section or operative vaginal delivery. But certainly if you're worried about the baby, I'm worried about the baby being too large, then ultrasound scans will help confirm this, and sometimes a caesarean section is done rather than going through a labour, which is unlikely to work out well. So I hope that information helps, and I look forward to speaking to you soon. Bye for now.